Hello, I'm David Kerr, Professor of Cancer Medicine at the University of Oxford. I'd like to talk today about a study that's been published recently in the Lancet that is science fiction becoming science fact. The title of the paper is Individualized Neoantigen Therapy plus Pembrolizumab versus Pembrolizumab Monotherapy in Resected Melanoma. It's a randomized phase 2b study. More about the design in a moment. We know that neoantigens are immunogenic molecules which are usually arising from nonsynonymous cancer-specific mutations. These are then translated into proteins which are processed and presented through MHC and can stimulate really strong T-cell responses, part of the whole sense of activating the body's own immune system to recognize and destroy tumor cells. In this setting, this adjuvant setting following resection of melanoma, we know that checkpoint inhibitors are fairly effective. There's still a very large number of patients relapse despite monotherapy with drugs like pembrolizumab. So here they made a personalized messenger RNA vaccine that was individualized. I mean, a remarkable technology. The way that they went about it was that the transcriptome was established by RNA sequencing using patient-specific data from whole exome sequencing, RNA sequencing, and then HLA typing. So they take all of those data points of individual patients, they feed it into a bioinformatics system, which then establishes the amino acid sequences of up to 34 selected neoantigens. They're ranked from top to bottom. The top amino acid candidates are then incorporated into an optimized concatenameric messenger RNA sequence. It's a big, long, continuous messenger RNA molecule, which is electronic, which is then manufactured as a patient-specific, individual messenger RNA vaccine. That's fantastic. I mean, just every sort of element as to what one would sort of choose as to how one would, if we talk about personalized medicine, this is at the very sort of cutting edge of it. So what are the results, however? So it was a 2-to-1 randomization. It was a study that was led by an excellent bunch of US and Australian investigators. Conventional doses of pembrolizumab were given. The vaccine was given towards a maximum of 9 doses intramuscularly in combination with conventional dose pembrolizumab. They randomized 157 patients, 107 to the combination therapy, and 50 to pembrolizumab monotherapy. Median follow-up was around 2 years. And what they demonstrated was that the recurrence-free survival was significantly longer with combination versus monotherapy. The 18-month recurrence-free survival, choosing that as a categorical cutoff, was 79% for combination therapy versus 62% for monotherapy. Most of the treatment-related adverse events were relatively straightforward. But grade 3 and grade 4 adverse events were seen in about 25% of patients in the combination group, 18% of patients in the monotherapy group. So what they've demonstrated, I think, convincingly with some very solid statistics, hazard ratios and so on, is that you can significantly prolong recurrence-free survival with this combination of immune checkpoint inhibitor and this remarkable personalized messenger RNA vaccine. So think about all the different elements of science that have come together, our understanding of immunology, our understanding of neoantigens, our understanding of antigen expression, the various elements of it, how we can get immune spreading, how the immune cells, the T cells in particular, respond. And at the very cutting edge of sequencing technology, whole exome RNA transcriptomics, and those coming together by an AI-driven bioinformatic model that selects the best personalized vaccine for you. I stand in awe of this science, and it's the future. There's more yet to come. There's a ton of work going on in Oxford looking at how we can find other neoantigens, how we might be able to persuade various elements of the dark genome to yield up new peptide targets and so on. It's an incredibly hot competitive area. But what a promising study and a staggering piece of clinical translational science. Have a look at it. I am Ozymandias, King of Kings. Look in my works, ye mighty, and despair. Just for once, this might be true. Have a look and see what you think. For the time being, Medscapers, over and out and ahoy. Thanks for listening.